What I tried to do is give you a side-by-side comparison of the facility master plan budget going back to July of 2004, benchmarking us, as a lot of people remember, in December 2005, and actually backing up to numbers that were last reported to you on May 22nd, just to give you a sense of the side-by-side analysis of where we're at today. I think a couple things are worth mentioning. I'll go through this project by project to a certain extent. This is PMC West. It should be page 2 in your handout. If we look here in terms of square footages, a couple things that's important to note. Initially, we had the hospital support building in the full numbers of the build-out in July, and we have now decided that over here in 2007, that would be an opportunity to off-chart or developer-base possibly those buildings. We're shelling a little bit more than we initially thought in the building. Again, the hospital support building here. Central plant, it was an opportunity here, probably the biggest delta in terms of off-chart or potentially going out to an outsourcing of our central plant. Again, these are numbers that help us realign to the 983. If you recall the presentation back in May, where we were approaching or projecting close to 1.2 billion. Segue to Pomerado. Variances are here in terms of the square footages. The hospital remodel has been reduced. That's when I say remodel, those are remodels that were initially planned within the existing hospital itself. The new tower was increased mostly, as you know, through market conditions, escalation, and other things that really caused market increases to the project or commodities. We're shelling more. And the D&T addition, that is the, when we say connector of the bridge, that component that's important for us to move ahead with before we move ahead with the tower and some of the other infrastructure components here. This looks at Palomar Medical Center East. It was important to note that this hospital probably maintain for a little while longer in its current state. After we move to the new hospital, it's important to recognize that the Women's and Children's Hospital component will be maintained at this facility. I'm not trying to puzzle you with these question marks, but the team is looking hard at the downtown project in terms of opportunities, how we maintain our women's and children's services there, what are there other off-chart developer-based interests that would support this, along with some research and analysis that I know Sheila Brown's working on very hard in terms of partnerships, both for the rehab capabilities of this hospital as well as the outpatient behavioral health components of the hospital.